Congenital anomalies of the limbs usually present. Number one is the acromegaly. Acro mean extremities, upper lower limb. Megaly mean large extremities, acromegaly. It is due to the overgrowth of the bones. Bone become more long. Say femur size, for example, if we say it is 30, it become 40. So like this, that acromegaly is the elongation of the bones, and that is due to the excessive production of the growth hormone from the pituitary gland. Pituitary gland produce growth hormone. So a condition occur which is it is due to congenital hyperpituitarism. That is the overfunction of the pituitary gland, which causes excessive production of growth hormone. And growth hormone act on the symphysial, that is the growth plate of the bone, or the which proliferate rapidly and responsible for the increase in length of the diaphysis. So growth cartilage is affected by growth hormone. Characteristic: disproportional enlargement of face. Face is large. Hands and feet, that is large. Long limbs. Another name given is gigantism. Gigantism. Number two is the microcephaly. It is an abnormality. It is an abnormal. ठीक है खाना ना गए बट ठीक. Next condition is the microcephaly. It is an abnormality in which brain fail to grow and skull fail to expand. Such children are severely mentally retarded. Small skull abnormality, brain fail to grow. Another condition which is related to the limbs is the meromelia. Meromelia is the partial absence of one or more extremities. Absence of that one upper limb is absent, as in small diagram shown, that this upper limb is absent and other is normal. Partial absence, it may be partially or the complete absence of the limb. Amelia is the complete absence of the limb. So it is if there is a partial absence of one or more extremities, that is the meromelia. Amelia, no limb, A, and that is absent. It is the complete absence of the limb. Phocomelia, it is due to the absence of the long bones, which lead to direct attachment of the head or feet. Phocomelia is due to absence of the long bones and direct attachment of the hand and feet to the trunk by small irregular shaped bones. So hand is directly attached to the trunk. No long bones are there. That is the humerus, radius and ulna are not present. Hand directly attached. Micromelia. All the segments of the extremities are present but abnormally short. That limb do develop, but small in size. Size is small. There is a condition that is shown, that is the meromelia, small segment of the limb which is attached. Half limb say develop or partial development of the limb, meromelia. Amelia is the absence of the limb. Other limb is fully developed, but one side limb is absent. Micromelia, in which they say this lower limb has full thigh, leg, knee joint and foot, but this is very small segments which are present. Limb is small in size, micromelia. During development, what is seen is another anomaly is that polydactyly. Polydactyly, in which the more than 5 fingers are present, or 6 fingers usually are seen. That is the 1, 2, 3, 4, 5, and this is the extra finger, which is the 6th number. Similarly, over here, it is the extra finger. Extra finger is always present on the sides of the hand, that is on the medial side or the lateral side, but not in the center or in between the fingers. It is not there. Syndactyly condition, in which the fingers are fused by webs. They are fused, a fusion occurs, and webs fail to disappear. Similarly, that is the fingers normally have webs during development. That web failed to disappear. So two fingers are fused, or toes are fused, or fingers are fused. Here is the cleft foot, that is the two toes are fused on one side and two others, and in between is the third is absent, and a cleft is seen. Foot is the similarly a cleft is seen over here due to absence of one digit. The brachydactyly is a condition in which the fingers and toes are small in size. Phalanges are small. Phalanges are small. Hand is fully developed, but phalanges are small in size. So fingers are small and toes are small. Here is shown the polydactyly and the fused fingers syndactyly. Similarly, in the hand, fused fingers, that is shown. Here is shown the development of the limb, in which limb is developing, and this is AER, and it produces a substance which acts on the mesenchyme. This mesenchyme immediately below the AER is undifferentiated, whereas this all is differentiated, and this start developing into cartilaginous bony models like this humerus, radius, ulna, carpal bones, and phalanges. Fingers are fused by this webs or the tag of the skin. It is the initial presentation of the hand plate that limb become wider, and it is the hand plate which is the shown. Later on, fingers are differentiated but still connected by this webs in between them. Later on, they are separated. It is the appearance of the upper limb which is earlier than the lower limb that develop from the side of the trunk. This is the initial development of the limb bud, upper limb bud and lower limb bud, and this is also shown the developing upper limb and the lower limb. Here is the cartilaginous model, which the tarsal bone, the ischium, hip bone, lower limb, pubic bone, femur, and the tibia and radius, tibia and fibula, tarsal bones, and phalanges. Their bones are shown to be appearing. Here is also shown the syndactyly, that pinion of the fingers are there. This is also syndactyly mostly seen in the foot, that is second and third toe are fused or look like single. Here is the two toes on one side, two other, one is absent, so that produce a cleft foot, that is the cleft foot. Here is the polydactyly, that is 6 fingers, that is 1, 2, and 3, 4, 5, 6. That is shown in the hand. Amelia is absent of the limb. This is the inverted foot. Inverted foot or club foot, congenitally present in those cases which are breech presentation, which means buttock is down, head is above. Before the delivery, when the fetus engage in the pelvis, the foot is under pressure and fail to grow or become straightened, and that become turned inward, and condition is known as the club foot. Foot is inverted. This is also again the cleft foot. This is the inverted foot. They are usually maybe bilateral or unilateral. Here is the various condition and their definitions are polydactyly, extra finger or toes, extra digits lack the muscle connection, no muscle present in between. In the extra finger, that is usually attached by the skin, or sometimes the bony attachment is there. So synostosis, fusion of the fingers, it may be cutaneous, that is skin attached, and it can easily be separated and cut off, or may be attached by the bony, which is shown as a hard simple webbing, more in foot, that more is seen in the foot as compared to the hand, and that fail to the skin between the fingers fail to degenerate, so the fingers get fused. Extra digit is polydactyly, is the medial and lateral, not in the center of the hand. It is inherited as dominant trait. Ectrodactyly. Ectrodactyly, absence of the digit, like thumb, is usually unilateral. Another condition syndactyly is abnormal fusion of the fingers or toes, which I told you it may be cutaneous or osseous, bony or cutaneous attachment, and mesenchyme persists between the fingers and toes, and that fail to break down. Common between the third and fourth fingers and second and third fingers. It is simple recessive trait also. That is the inherited condition. Cleft hand and foot are lobster claw deformity. Lobster claw deformity. It is abnormal cleft between the, as shown in the diagram, that between the second and fourth metacarpal bones, second and fourth, and soft tissues. The third metacarpal and phalanges bones are absent, almost always absent. Thumb and index finger, and the thumb and index finger on one side and fourth and fifth finger the other side are fused, and the third finger is absent. Club foot. Club foot usually accompanied syndactyly. The sole of foot turned inward, foot is adducted, plantar flexed. It is due to abnormal position in the uterus. 50% cases it may be bilateral. Another is the congenital hip dislocation. Consists of underdeveloped acetabulum. Acetabulum failed to develop, and head of the femur also not poorly developed. Dislocation occur after birth. Such cases are the breech deliveries, which I told you on the buttocks. The fetus are engaged and causes pressure on the developing foot. They become inturned due to pressure by the breech. The breech presentation inhibit the hip, also inhibit the interfere the hip development. So not only the it causes responsible breech presentation that is responsible for the club foot, but also hip dislocation, that is the hip joint is failed to develop. It is associated with laxity of the joint capsule. Another condition which is seen is the achondroplasia. Common cause of dwarfism are small stature, which lead to shortness of the stature. Achondroplasia. Limbs are short, bowed inward due to disturbance in the development of endochondral ossification at epiphyseal plate, especially of the bones. Trunk is short, head is large with forehead bulging. So it is the short stature. It is reverse of acromegaly, you can say. Cretinism, hypothyroidism. It is due to severe deficiency of the fetal growth hormone or agenesis of the thyroid. Thyroid failed to develop, or the thyroid is not properly functioning. Thyroid hormone production result in cretinism. Character of cretinism are growth retardation. Growth of such children doesn't occur. Mentally deficiency, skeletal abnormality, auditory, hearing, and neurological disorder, brain disorder. Epiphysis develop is delayed. Epiphyseal development is delayed. Next condition is brachydactyly. Shortness of digits is the result of reduction in the length of the phalanges. Phalanges are not developed. It is inherent dominant trait. Next is the congenital absence of the radius. Radius is partially absent or completely absent. When radius is not there, hand is deviated laterally. It is due to failure of the radius to develop. Another condition which is related is the rickets due to vitamin D deficiency. Hereditary vitamin D deficiency rickets result from mutation in the vitamin D receptors. Those receptors which are receiving the vitamin D, there is mutation occur, alteration occur. So they fail to catch the vitamin D. Deficiency of calcium and phosphorus causes disturbance of the ossification of the epiphyseal cartilage plates. Epiphyseal plates are disturbed, limbs are shortened, deformed, with the severe bowing of the limb bone. Limbs are like this, they bow outward rather, and convex outward, concave inward. So these are the bowed limbs. In development of the limbs, nerves also provide sensory innervation to the dermatome. In addition to the motor fibers to the nerves, neurocrest cells surround the motor and sensory nerve fibers to form the sheath of Schwann or myelin sheath. In fifth month, peripheral nerve grow from the developing limb, lumbosacral and brachial plexus into the muscle masses. Spinal nerves are distributed in segmental bands, supply both dorsal and ventral surface of the limbs. Spinal nerves are distributed in segmental bands which supply the both dorsal and ventral surface of the limb. A dermatome is the area of the skin by definition supplied by the single spinal nerve. Dermatome also overlap. A cutaneous nerve area is the area of the skin supplied by a peripheral nerve. So dermatome is the area of the skin supplied by single spinal nerve, and they also overlap. Or cutaneous that is the area of the skin supplied by peripheral nerve. Upper limb buds can be traced down the upper limb that can be traced from lateral aspect of the upper limb and back into its medial aspect. From lateral to medial, dermatomes are counted. Lower limb, which may be traced down the ventral aspect of the lower limb, then to the dorsal aspect of the lower limb, that can be traced. We'll continue.